Gestational diabetes is a temporary condition found only in pregnant women. Only 2 to 4% of women are prone to this condition, and it is suggested that women be screened during pregnancy for gestational diabetes. Videos show gestational diabetes as a temporary condition found only in pregnant women. Only 2 to 4% of women are prone to this condition, and it is suggested that women be screened during pregnancy for gestational diabetes. Generally, gestational diabetes is discovered during the second trimester of pregnancy, and there may be an increased risk in the child contracting diabetes after birth. In gestational diabetes, the blood glucose sugar levels are too high and thus harmful to both mother and child. In most cases, this type of diabetes can be managed through diet and regular exercise and disappears after the birth of the baby. Some of the most common risks are a family history of diabetes in parents or siblings, gestational diabetes in a previous pregnancy, birth defects in a previous pregnancy, obesity, mature age over 30 years of age, previous miscarriage or stillbirth, previous birth of above average size baby, history of high blood pressure, hydramnios and urinary tract infections induced by pregnancy, African American, Hispanic and First Nations descent. Diabetes remedy on gestational diabetes. Symptoms are generally mild and of no real threat to the health of the mother and child. Symptoms may include an increased thirst, increase in need to urinate, infections of vagina, bladder and skin, nausea, vomiting, blurred vision and fatigue. After birth, the blood glucose levels generally return to normal and symptoms disappear. The effect may affect the size of baby upon delivery. The baby may be either too small or too big, which increases the chance of complications during labor. Some research indicates that gestational diabetes increases the risk of pre-eclampsia, which is caused by high levels of protein found in the urine. Pre-eclampsia is a serious complication and can have a dire effect on both mother and child. Gestational diabetes may cause the baby to suffer from jaundice, chemical imbalances, low blood sugar and growth abnormalities. During a pregnancy where this type has been diagnosed, both mother and baby are strictly monitored, and the mother will be trained to monitor and maintain her blood glucose levels for the remainder of her pregnancy to ensure the health of herself and her baby. The appropriate treatment and monitoring of both mother and baby will reduce the risk of fatal complications. Close observation of both mother and baby will continue after birth, reducing the risk of developing full-blown diabetes. To find out more about diabetes remedy, visit the link in description below this video.